This is Damian McNamara with Global Medical News Network, and I'm at the Skin Disease Education Foundation Women in Pediatric Dermatology Seminar in San Francisco. And with me is Dr. Pearl Grimes, who is Director of the Vitiligo and Pigmentation Institute of Southern California and Clinical Professor of the Division of Dermatology at UCLA. Part of your talk here on vitiligo is how important the psychosocial aspect of this is for patients and how good dermatologists are addressing that. Can you tell me more?
The psychosocial aspects of pediatric or childhood vitiligo is so important. I think that current studies suggest that children are devastated by white patches. I call it white patches and bruised soles. We have data now which suggests that when vitiligo occurs during the formative years and children have very negative experiences associated with their vitiligo, it's very clear that they literally become fossilized in that traumatic or those traumatic events, and they take it into adulthood. What is the outcome? Low self-esteem, stigmatization. It interferes with personal relationships, the work environment. So, looking at the psychological component of this disease, quality of life studies, I think it is so important for dermatologists to be cognizant of these issues so that we become much more aggressive in treating the disease, as well as being willing to refer these patients out for psychological counseling when appropriate.
Which therapies do you think are most promising for pediatric and childhood vitiligo in the future?
There is an enormous amount of data now on the role of oxidative stress, free radicals, as a cause of vitiligo. Now, how will this translate for treatment? I think that we will begin to look at studies addressing the role of nutrition. And one of the things that I will address in my lecture, I'll talk a little bit more about oxidative stress and the importance of nutrition in being able to deal with this aspect of the disease. And I think it becomes a very exciting new area for new therapeutic studies, research studies.
Okay, so overall, what is your take-home message from your pediatric vitiligo talk here?
I think my message is work up, diagnose, and please engage the children and their families, because if you treat them, these kids are going to have better long-term therapeutic responses compared to what we see in adults. And I think we really do have the ability to stabilize as well as repigment. And stabilization probably is even more important than repigmentation.
In terms of disclosure, I should tell you that my news organizations and the Skin Disease Education Foundation are both owned by Elsevier. Do you have any relevant disclosures related to your vitiligo talk?
My relevant disclosures, I do clinical trials for many companies. I think with regard to the vitiligo talk, probably my only disclosure would be some of my research has been supported by Astellas, but I think that's pretty much it.
Okay, this has been Damian McNamara with Global Medical News Network speaking with Dr. Pearl Grimes. Thank you very much.